Hello, I'm Dr. Anthony DeCestro, and welcome to the Slender Ray Patient Experience. When the patient arrives at your office, warmly greet them and hand them the required Slender Ray paperwork to fill out. This should only take between 5 to 10 minutes. Ask for a copy of their driver's license or photo ID to keep on file, as this will help to ensure that the correct patient is being treated. When the patient finishes the paperwork, they should be handed a video-enabled device to view the consultation video. This video explains a brief history of the technology and how the Slender Ray works. While the patient watches the consultation video, the technician should review the patient's information, looking for anything that may make this patient an unfit candidate for the Slender Ray treatment. Some of these contraindications may include any history of cancer, whether in the desired treatment area or not, any photosensitivity, which can be caused by some antibiotics, diuretics, and long-term chemotherapy. Minor redness of the dermis or subsequent minor swelling may occur in a small number of patients, regardless. Are they on any antidepressant medications, which can interfere with fat metabolism, so an increased number of treatments may be necessary to reach the desired result? Do they have a history of epilepsy, especially if we're using any of the modulation programs designed for specific outcomes? It's important to know if they are pregnant or currently lactating, or if they have a history of any uncontrolled hypertension. A history of liver or kidney disorders may preclude them from being able to use the Slender Ray, or if they are currently being treated for any thyroid gland dysfunction which would get in the way of fat metabolism. If they have a compromised immune system, it's important to know that. Or if they are under the age of 18, they would need signed parental permission to continue. Upon completion of the consultation video, the technician will escort the patient to a private room to begin the consultation. The consultation in the treatment room. The technician should introduce themselves and ask if the patient has any questions about the video they just viewed or the Slender Ray program itself. They will discuss the patient's desired target area and inch loss goals and their expectations. Now, it is extremely important to manage the client's expectations. You will undoubtedly encounter a patient that expects far above what the best technology in the profession can offer. It's important that they understand how the Slender Ray works, why it works, and what their part in this is. The technician should emphasize the importance of tracking the patient's caloric intake and clearly explain that without compliance, the patient will not achieve the desired inch loss. If a patient is not willing to comply with the caloric restrictions and light exercise requirements, they should not move forward with the Slender Ray program. During the consultation, the technician will evaluate the number of sessions necessary to achieve the patient's inch loss goals. Most patients lose a total of 8 to 12 inches over 3 measurements during an 8 to 12 session treatment plan. Variables such as thyroid conditions, antidepressants, and non-compliance to the program will affect results and should be clearly explained. If upon completion of the consultation the patient is deemed a good candidate, whoever is tasked with securing the financial obligation and/or compensation should be introduced to the client and arrangements made for payment or to secure financing. When payment has been rendered in accordance with the signed agreement, the technician can, based upon availability, either schedule the client or begin treatment by showing them to the treatment room. Measurements and treatments. The technician will ask the patient to expose the desired treatment area for measurements. We currently take 3 measurements over the treatment area. More measurements can be taken, but we found the 3 measurements sufficiently show the inch loss and are not too time-intensive or artificially raise the numerical result. In most cases, the treatment area will be the abdominal region and love handles, which will require the patient to lower their waistband and to raise their shirt. As a constant, we take a measurement at the navel, 2 inches above and 2 inches below. The measurements will be recorded and the patient will be shown to the treatment table. Placement of the emitter and body is fairly constant, with minimal changes occurring dependent upon the Slender Ray equipment at your location. Please keep in mind, we want to keep the patient as comfortable as possible throughout the Slender Ray procedure. After the patient is in a comfortable position, have them put on the protective eyewear. The emitter should be placed directly above or below the desired treatment area, 2 to 4 inches from the body. And press start on the Slender Ray. Depending on the Slender Ray equipment at your location, the patient may need to be repositioned for as many Slender Ray exposures as necessary. After treatment is complete, you will measure the patient as you did before to record their inch loss results. This is done initially after their first visit and after treatment every 3 visits. Record the measurements. Calculate the inch loss and share the results with the patient. Remind them that to get the best results, they should engage in at least 30 minutes of cardio after their treatment, not eat 2 hours before or after treatment, and that they should cut a predetermined number of calories out of their diet on the days that they treat. Disinfect the treatment table and get the patient scheduled for the next treatment. The following are some of the other areas that can be treated with the Slender Ray. Although the emitter may be placed anywhere there is subcutaneous fat to achieve inch loss through radiant lipolysis. Please contact Slender Ray Corporate for specific questions related to other body areas requiring treatment, such as breast and facial inquiries. This is Dr. Anthony DiCesaro wishing you much